So, good evening to all of our Facebook friends and families, and welcome to Couch Conversations, where true health is wealth. So, what is wealth? Wealth is health. So, good evening to Facebook, Instagram, Periscope, Twitter, and to all of our social media families. What is tonight? It is Monday night, and on Monday nights, what do? We have Couch Conversations with the doctor. So that's what we are here to do today. So remember to share, share, share. Hello, Yolanda Williams. I see that we have everyone chiming in. Hi, Yolanda. Good evening to you just as well. So, on Monday nights is Couch Conversations with the Doctor. So, I just want to remind you to share, 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 send those likes and those hearts so we can continue to share that health is wealth. As always, we tend to go around the table and we do a brief introduction of everyone who is here at this time. I want to say hey to Martha, who has checked in just as well. Hi, Martha. Good evening. Thank you for checking in. Thank you. Remember to share this conversation. Start your watch parties and share them on your page. Invite all of your friends to learn about couch conversations. As we go around this table really quickly to do our introductions, as always, I'm going to introduce my co-worker, Douglas Graham. Doug, co-worker.
Good evening. I'm starting my second year working in Representative Davis's office. I'm a retired physician who's now a congressional fellow, and I'll try and answer your questions if I can.
Wonderful, wonderful. Dr. Jasmine.
Good evening. Oh my God, today is a new day just to get it right and to be intentional in everything that we do. I am a licensed clinical psychologist at Near North Health Service Corporation. I'm in Chicago, Illinois. I'm always happy to be here, specifically tonight as we focus on mental health. So welcome.
And as she always says, and I mimicked her on last week, remember mindfulness. That world-renowned urologist, that doctor who keeps everything going. Hey, Jack Lynch, I see that you checked in with us just as well from Gift of Hope. That's no other than the master of urology. That's Dr. Terry Mason.
Well, maybe in my old days, but I'm always grateful to be here with you, Nikki, and the congressman. I'm just grateful that the congressman is here. He's been unscathed by the events of earlier this week. So I'm just grateful that he's here and he's healthy and not touched by that. I'm always in great company with the group that's here. And to see Bob Urso and Henry Taylor, that takes me back a bit. Back a long way, as do Henry Taylor and I. So I'm grateful to be here on this panel.
Wonderful, wonderful. To that weight loss guru, that family medicine doctor, the one who thinks he's a small-time Wolfgang Puck. Let's say hey to Dr. Tony Hansen.
I am so excited to be here tonight. I'm always excited for a new year. A lot of good things happen when you get inspired to look at yourself and reflect and do things a little better than you did previously. So happy to be here. I'm a family doctor, obesity doctor with Advocate Aurora Healthcare.
So I want to say hey to my sister friend, one of my best friends, that's Melanie Winston, who has checked in just as well. Yeah, so these next three people, I want our congressman to actually introduce. I couldn't dare give them justice, but what I will share with you is this. I want to know which one of you can actually tell me in the comments who's an adamant voter and who in the comments is one who loves the oil paint. So let's see if we can come up and get that straight. So Congressman, if you could introduce our next three guests, that would be great.
Well, they really don't need much of an introduction, but I'm delighted to be here. I just had my second vaccine shot the other day, and I'm feeling good. As a matter of fact, my arm feels better now than it did before I got it. So it seems like both are working well and doing well. I'm a little bit, under, because last week we lost one of my heroes, a fellow named Jack Geiger, who is the founder of Community Health Centers. And Dr. Jack Geiger is one of the most inspirational people that I have known. I remember the first time that I ran into him in New York at a training session that we were having. And from that moment until now, uh, he has impressed me tremendously. He was still working after being 90 years old. He still he still worked,
Indeed.
but still helping prepare young physicians and helping generate scholarships for individuals to go to medical school. And so I had a conversation with Tom Van Cumberland earlier today, who is president of the National Association of Community Health Centers, and we're trying to figure out how we're going to do something to honor Jack Geiger and pay tribute for the tremendous work that he did. We have three individuals with us tonight that I am so pleased they could join us. Of course, Bob Urso is retiring, as he mentioned earlier, after having been the founder and principal developer of PCC Wellness Care. And that has meant so much to healthcare in the west end of Chicago and the west suburbs, uh, located basically principally in Oak Park, Illinois, which is one of the great cities of our state. And I suspect that Dr. Nicole Gast is with him, and we are delighted to have both of them. And of course, Henry Taylor, who I rely upon because every time I go to the doctor, I have to go over there where Henry Taylor resides. So that's where I get my primary health care, at the Mile Square, which was actually the third federally qualified community health center to be developed in this country.
That's right.
So Mile Square has a long history of being part of the initial, and to think that these centers went from one in Mountain Bayou, Mississippi, 3 Mile Square over on Washington Boulevard, now serving between 25 and 30 million low and moderate income patients all over the United States of America. And so, as far as I'm concerned, they are some of the most important elements of healthcare delivery in this country. And so I'm delighted that Henry is also here with us. And I guess maybe we ought to just start with Bob. Bob, I've been fortunate to know you for a long time and to know the tremendous work. I live right on the edge of Oak Park in Chicago. I live on the last block in Chicago. And when I cross the street on Austin Boulevard, I'm in Oak Park. So we have been neighbors, friends, associates for a long time. And while we hate to see you retire, you never should hate to see anybody retire. But when you leave and you've left something in good shape, and you know that your print is there and it will continue, I congratulate you on an outstanding career. And why don't you start telling us about PCC Wellness Care?
All right. Well, thank you, Congressman Davis. I think, first of all, thank you for all of your support that you've given F2HCs. PCC, we were established in 1992. We actually, in 1992, I was in charge. I was the ambulatory care administrator. We were responsible to take a department of the hospital called the Parent-Child Center and spin it off and create a 501c3 not-for-profit FQHC lookalike. I came back in 2001, and PCC is now 13 sites. For 13 sites, I'm going to specifically talk about our behavioral health program. Our behavioral health program, we have clinical licensed social workers, and we have psychiatric APNs. So our program is made up of those two disciplines. In addition, we have a very comprehensive chemical dependency clinic over at West Suburban Hospital where we provide Suboxone treatment. In addition, we have now started an addiction medicine program at West Suburban Hospital. It's in cooperation or partnership with Rush University Medical Center. So we're very excited about that. We're also one of the few programs in the state or in the city that's actually providing Suboxone to high-risk mothers. Our motto is principally family practice doing about 1,000 deliveries a year. We manage the OB floor at West Suburban. Our behavioral health program, we really designed it where it's integrated behavioral health before COVID. So in other words, if a provider's in a clinic setting and talking with a patient and a patient says or brings up a problem, any kind of behavioral health problem, domestic abuse, anything that relates to that, the provider will say, would you like to see behavioral health? And a behavioral health staff member would come right down to the clinic and talk with the patient and create that relationship. What we found in COVID is that we've had to shift away from integrated to more acute because that's where we see the need with telemedicine. So it's a comprehensive program. We've opened it up to other patients not assigned to PCC. In other words, what I mean by that is with the MCOs, patients are assigned to your site, but we have open access for everyone. So that's a quick overview of our program and what we're about.
You know, Bob, that's really good. Could you talk a little bit about the acute piece? So you were saying that typically the providers are called downstairs or wherever they're housed if something arises and within integrated behavioral health, but then with COVID, you've shifted to more of an acute. Could you talk just a little more about that?
Yeah, sure, Dr. Jasmine. What we found was that with telehealth, there was that phone call by the provider. Then there would be a follow-up phone call by behavioral health. So what happening was the non-response rate to behavioral health was very low. So here's basically what happened. Productivity went down. Frustration was very high with the staff. So we pulled the staff together. We talked with the staff. We redid the templates and we shifted more towards acute because that's where the need was. They needed someone to talk to now.
Mm-hmm. No, totally agree. That's why that's the totally, I, as a psychologist, I'm actually embedded in the clinics and like I sit there and I noticed too, the numbers went up, but because they needed you right now, right? The acuity. So that's good stuff though. Thank you. Yeah, that was good. Yeah.
Henry, why don't you give us a little shot of Mile Square and then we'll just open up
Certainly.
sesame for the questions and all that.
Thank you, Congressman, for inviting me to participate in this event tonight. And Happy New Year, everyone. I brought with me Dr. Nicole Gastala. She is our Director of Behavioral Health Services at Mile Square Health Center. But just by way of background, Mile Square has 14 clinical sites throughout the city of Chicago, Cicero, and Rockford, Illinois. We most recently opened up a site in Rockford in May of last year. So we're now in the upper parts of Illinois. In our practice, we have an integrated behavioral health model, and a vast number of our providers today provide medication management, Suboxone treatment, a big event for Miles Square. Beyond providing comprehensive care, we also provide an array of specialty care, the first ever cancer survivorship program that's in an FQHC, the first urgent care practice that's dedicated to providing care to the underserved, with a focus also of urgent care for behavioral health. So any person, and I'll let Dr. Costella really shine and share more about our behavioral health program in detail. But most noticeably today was the first day when we launched our partnership with Guardianship. Did I get that right?
Family Guidance.
Guidance, thank you. I don't want to call it Guardian, the Family Guidance Program. And we started providing methadone treatment today at 6 o'clock in the morning. So our practice opens up at 6 a.m. in the morning so that patients who suffer from chronic substance abuse can get the medication they need in an FQHC. What's unique about this model is the patients who are getting their medication, may it be Suboxone or opioid or methadone, they also get the link back to primary care. We want every patient to get their primary care, no matter if they're getting dental care or behavioral health. One of the things I'm most proud of, and Dr. Gascala has served as the architect, and I use that term deliberately, of our behavioral health program, is getting feedback from our patients. And one of the things I'm most proud of is feedback from a particular patient who said, this is a place where there's no judgment. So when you walk into Miles Square at any of our sites, you're able to get care, but no one knows what you're there for. Getting care for behavioral health, substance abuse should be no different than a person who's getting care for hypertension. So Dr. Costella, if you would be so kind, give them the details regarding our behavioral health program. And I'm proud to say just over this holiday, Dr. Costella was featured on PBS for our relationship with the Night Ministry program and providing behavioral health to homeless population. So Dr. Costella.
Thank you, Mr. Taylor, and thank you so much, Representative Davis, for having us here today. I think one of the biggest areas we really focus on is getting patient feedback. Where do they need help? When do they need help? And what are the barriers that are impacting their ability to access care? And so that's really how we've designed everything from the ground up. Part of it is an integrated behavioral health system within primary care. We have an LCSW at every site who has a combination of scheduled appointments for follow-up, as well as room for walk-ins, as well as brief handoffs from primary care. We also have embedded a psych APN and an LCSW in our urgent care, and they're available 8 to 8 Monday through Friday, Saturday, Sunday, all holidays, so that patients can walk in and receive services that they so sorely need. Another area that was really important to improve access was medications for opioid use disorder. During COVID, we have seen such a spike in the opioid overdose epidemic. I think in July, we had already hit the numbers of overdose in the year prior, just in those 6 months. And we know that it impacts our West and South side the most, particularly African-American men in their 40s, 50s, and 60s. So we really have tried to really decrease all barriers to access for care, including walk-in services for Suboxone same-day intakes, and now the integrated methadone services, which we feel are really important. Since there's been a change with COVID, we've been able to really utilize telehealth, which has allowed us to partner with those community partners. So Night Ministry, Chicago Recovery Alliance, just to name a few, where when the street teams are out and they meet with patients and they are interested in behavioral health or addiction treatment, then they are connected to a provider immediately to sort of provide those services. And then we work with them regularly to follow up and coordinate care, again, really to access services for the most vulnerable patient population, including our unsheltered homeless.
Well, Nikki, you got questions and all that. I can't help but mention that I used to work for a psychiatrist who was a pioneer in methadone, Dr. Kermit T. Mellinger. And he also was on staff at the VA, and he also was on staff at Chicago Medical School. He started a methadone program at the clinic where we were without authorization. And while he went on vacation, the board sent him a telegram and told him to keep on sailing. But we had a lot of fun. But I think methadone is not as controversial now as it was then. This is back in 1969, 70. But at any rate, go right ahead.
So sure, Congressman. Let's see. Hello to Curtis Jones, who I see had checked in. To Jack Lynch, who says, Dr. Mason, I'm totally in agree with you. The safety of the congressman is the best. To Melanie Winston, saying that that's amazing. Martha sends her condolences to you, Congressman, in the passing of your friend. Sean Kennedy says, good evening to everyone. And Philip Burton, the president of NARCI, is here. And he says, hello, everyone, and Happy New Year. So just want to share those, and I guess we'll get right into those questions. So the first question says, can sexual promiscuity be a form of depression? So I don't want all of you to take that question at the same time, but just one of you can grab the question.
Nicole, we forgot to introduce Pete Thomas.
Oh, that's right. I'm
Yes.
so sorry,
What's going on?
Hey.
Everybody's coming in, and everyone missed you so last week when you were under the weather. So of course you have to introduce yourself.
All right. I'm Pete Thomas. I'm a general internist. I'm the director of medical support services at Near North. I'm over the MAT and the HIV program at Near North. I'm happy to be here.
All right. So now back to that first question. Do I need to repeat it or all you guys got it? Can sexual promiscuity be a form of depression?
Jasmine, you got this one.
You got to unmute
You're muted,
yourself,
Jasmine.
Jasmine.
Okay.
I forgot. Out of respect for everyone else. So I guess we just have to kind of break that term down for the viewers out there. And when we think about sexual risk-taking, right, or hypersexual behaviors, I really see it as the practice of engaging in sexual activity frequently with different partners, okay? Now, culturally, it relates to sometimes having a one-night stand. I don't think that sexual promiscuity is connected to depression, okay? But people who are experiencing depression or symptoms of depression can go to various sexual partners or prefer various sexual partners to maybe make up for the loneliness that they're experiencing or the sadness, right? Maybe they want to avoid symptoms of maybe trauma, right? Or anxiety or depression in some form. And maybe they're engaging in these types of behaviors to avoid experiencing those symptoms. However, once we're engaging in these sexual risk-taking behaviors, after it's all over, what I often tell patients is that we're going to have to, in some form, experience those symptoms at the end of the day. So I do encourage for them to engage in therapy, right? To talk it out, to also kind of brainstorm the behaviors and if there's any other things that are going on that's interfering with their behavior. So yeah, anyone else can add too.
Yeah. I would just like to say that I think, like many disorders, depression can present itself in different forms. And so while we're used to, from a primary care perspective, and seeing depression express itself in terms of one's ability to sleep, it's either their ability to sleep too much or they're not able to sleep. They feel sad unnecessarily for no odd reason. The things that they enjoyed doing, they don't want to do anymore. But that's one form. But every culture or individual can express their depression in various ways.
Right.
And so many times people seek unhealthy behaviors like drinking excessively, having unprotected sex. One of the reasons why Jasmine and I, we are involved in our the EIS program at Near North. And so we provide this sort of integrated care. So many of our patients who are HIV positive or who are in our PrEP program will participate in unhealthy behaviors due to either a occult behavioral health problem, anxiety, depression, PTSD. So I would say that, I look for various forms of expression for depression, especially in Black men. We find that they don't have the sort of typical signs of depression, and so we have to be particularly on guard about how they express their depression. And I know many people here are familiar with the whole adage that if you ever want to find if a Black man is depressed, all you got to do is just look at how many times he's going to the liquor store or calling people that he know is not a healthy partner. And so we want to be careful about pigeonholing how patients might present themselves who are potentially depressed.
Yeah. And another thing I wanted to add is, I think a good point you made, Dr. Pete, that when we think about depression or any other mental health condition, it presents differently, right? So my thing, if I get sad or depressed, because I think everyone experiences some sadness at some point, my thing is probably I'm not going to have an appetite, right? Dr. Pete, maybe yours, and I'm just making up something right now, is watching TV, maybe binge watching and eating, overeating emotionally. Another person could be using substances, whether that's marijuana use, whether that's substances. It really depends on your thing. But oftentimes I do tell patients is if we're overdoing unhealthy behaviors, let's kind of look and explore what the function may be, right? Are we anxious? Are we sad? Are we lonely? Is something going on? What's the function? Or do we have a history of trauma here? Okay, that's not always the case, but let's really look at the function of what we're doing. So
Dolores Wow says, absolutely, Dr. P. Yolanda says, wow. Hetty Lake says, hello, everyone. And once again, Dolores Wow said, good evening, happy new year, and thank you, Representative Davis. Melanie Winston says, what about drinking red wine every day? Is that a sign of a man having depression?
Did she say of a man having depression or anybody in general?
She said, what about drinking red wine every day? Is that a sign of a man having depression?
You know what? Not necessarily, right? So when people often tell me that they drink glasses of wine, and this is just my perspective, right? I do ask, what's the frequency? What is the function? Why are we drinking? Has this been a habit before, or have you found out that you've kind of picked up on habits, right? So it really matters if it's really interfering with your level of functioning. So if we're drinking to sleep because we're depressed, because we're anxious, because we're trying to avoid trauma-related symptoms or whatnot, then perhaps we need to kind of learn different ways to manage or cope. But if we're just having a glass of wine of red wine, which is supposedly healthy in some way, if we're just having a glass just to wind down every now and then, right? And we're not using it to cope with things, then I think it's totally healthy, right? But if we're using it for those reasons in the former than the latter, then definitely we need to reach out. Yeah.
So that question also is added to about smoking marijuana every day from Yolanda Williams. Could that be a sign of depression as well?
Okay, so again, different forms. Everyone has their thing, right? So a lot of people, it depends on what team say, I use marijuana. And I'm gonna give you a perfect example. I see a patient in integrated behavioral health. They tell me, no, I ain't depressed. I'm not anxious, right? I get to the drug screening and they say, Dr. Cersei, I use marijuana every day. And I say, whoa. Tell me, or I'm wondering, give me some reasons. What are you using marijuana for? Oh, to relax and cope. I don't want to think about things. So then I have to really back it up and really provide psychoeducation, because using marijuana every day as a means to cope, if you got to sleep, right? If you got to use it to sleep, to eat, because you're anxious, or again, avoiding some type of negative feelings, we don't want to use marijuana that way at all. Okay. We just don't, right? Because that can become addictive. in many ways. So
Yeah, I think that's a good point. I think in the primary care setting, I know Dr. Hampton can speak to this also. We might be taking care of something totally different. And then let's say if you're a diabetic and we're trying to figure out, are you drinking a lot of your calories? And I had a patient today who told me he was drinking, I forgot what kind of liquor it was, but when he told me he was drinking a couple of shots, and I said, well, what do you call a shot? And he did his finger like this, and I was like, that's not a shot. I was like, a couple of those, that's a whole bottle. And so then that sort of opened up a whole nother issue. And so you really want to, you want to be involved in the primary care setting where you can. So in other words, I had to then sort of pivot and say, well, maybe we need to start thinking about having you see the substance use counselor, because not only am I concerned about the amount of sugar that you're taking in with these cocktails, but also the amount of liquor that you're drinking on a daily basis that you think is normal, and it is not. Tony, you have a.
Yeah, I'm having a flashback from college in a way where we went to school together, and there was a lot of alcohol in New Orleans. And so we had a group of people who drank alcohol, and they were at the daiquiri shop every day. And those people, you didn't see them the next year.
Right.
So it did impact their functioning. And then we had other people who on a Friday or a Saturday did their thing, wasn't a big deal. So the big message that Dr. Jasmine suggests is about this significant impact on your life. And if it's significantly impacting your life, no matter what substance we're talking about, it doesn't matter. That's not normal. And only comment I want to make about marijuana is that other than the concept of, you're doing it because you're dealing with this problem and you need to talk to a Dr. Jasmine, you have to be careful if your life is defined by substances, and if I exercised this morning and that was like a drug to me. So I had some dopamine and endorphin from exercising. So that's my drug, and that's the drug as physicians and behavioral health professionals. These are the things that we want to teach you, is that you can get high off of exercise. You don't have to. And then the other thing I want to say is that I don't have a lot of people I know who smoke marijuana every day that's productive members of society. I'm just saying in general. Now, you do have exceptions to the rule, but if you have to depend on substances, you really want to get somebody in your life that's going to help guide you to a different path, because the wellness path, living well, taking care of your body, reducing stress, that's a much happier life. And you don't have to depend on a substance to feel whole.
Yeah, absolutely.
I think I want to say, by the way, if you have a substance use problem, it does not make you a bad person.
Right.
And we try not to put judgment on that disorder. It's unfortunate that if you lack the neurotransmitter called dopamine that's in your system, and you seek that neurotransmitter by seeking out the substance that creates that elevated dopamine level. That's just like being a diabetic where your beta islet cells doesn't work in your pancreas. So we shouldn't judge people based on that. And I put the problem list, like we try to use substance use disorder, not substance abuse. Those kind of little things help to eliminate or at least
the stigma.
Reduce stigma.
And Bob, you wanted to say something?
Yeah. I was just going to say all of the questions really are elements where you need to then drill down and find out more information. The relationship to physical health and mental health. What impact is that having on your relationships with other people? And, with addiction and depression, denial comes into play so much. And the denial, and how, as a practitioner, you need to help the individual see where they're at, how they're using denial, and really focusing on relationships. And the other thing with addiction, and this is more of a personal story that I'd like to share for a moment, because it's had a great deal, very strong effect on me personally. And that is my brother. He had a son who really got mixed up with drugs. And it created so much of a problem in the family. And my parents wanted to help, and they would do everything they could, even when it came to providing money for treatment. And I don't know what turned him around, but now he has 2 children. He's very productive, but it was when he was ready. What was his motivation to do it? And that becomes so personal to each individual. And I think as practitioners, how can we help people connect that? And by connecting is being, like you said, Dr. Pete, non-judgmental, and to be there when they're ready. So that's experiences that I have seen. So
And sometimes having that conversation with the patient when they're sort of heading down that road and say, where are you at and where do you want to be? And how can we help you get there? Like, you're really close to losing everything. Like, we see that it's really impacting. You're telling me that these relations are impacted, these relationships, you're about to lose your job. Are you ready to take that step? Do you see what could potentially happen if you continue down this path? And what can we do to help support you in meeting your goals and helping you in your recovery, taking away that judgment and really just looking at it as meeting their healthcare, and personal goals like anything else. That can be really helpful for patients, and just being real with them about things aren't going well.
Yeah. I want to just piggyback on Dr. Nicole's comments. I want to read the definition of an enabler: a person who encourages or enables negative or self-destructive behavior in another. Now, what she just described is not an enabler. I'm going to help, I'm going to hold your hand. I'm going to help you get help, and I'm going to help you to where you need to be. But what you don't want to do is give crack to a crackhead. What you don't want to do is give a biscuit to a person who's struggling with their diabetes, right? So what you want to do is support people and help them, but you don't encourage or support behavior that's not good for them. So if I have a philosophy in my house with my kids and we have rules of the house, I'm not going to then allow my kids to go and spend the night in a hotel somewhere if that's not part of the culture of my house. So if you're going to help people, you have to love them well by giving them support, guidance, but you never support you're worried about withdrawal so you can give them drugs. We don't do stuff like that. But what you do is you show them a path. And sometimes, as suggested by Bob, you have to wait until they're ready to come. And, if you force the issue, it may not happen, but you just want to be a loving family member or friend to support them.
Yeah, and absolutely. When we think about I think about motivational interviewing stages of change, thinking about readiness, and that's from thinking about psychology. And as a psychologist in my practice, that's definitely the mode of treatment. Just thinking about our MAT program and EIS when I'm challenged with the task of talking about substances, motivational interviewing is one of those techniques. So. Yep.
Oh, wonderful. So our next question says, how long does depression last?
You know what? It really depends on the person, right? Okay. So I'm going to talk about person A and person B. Okay. Person A has felt sad, lonely, has lost sleep, has felt COVID-related fatigue for more than 6 months, but has decided to, let's say, utilize substances or other means to cope, right, with their symptoms, right? They haven't reached out to anyone. They have not even tried to pursue therapy or even medication management to treat those symptoms, right? That's person A. Person B goes to their primary care doctor at one of our lovely federally qualified healthcare centers, and they tell their primary care doctor, hey, you know what, Dr. Jazz, I've really been feeling down. I've really felt depressed. I can't sleep. I'm not eating. And I'm even drinking every day. Dr. Jazz suggests, hey, why don't you talk to someone in behavioral health before we try medications? And then they go on to treatment. Person B could possibly, in 3 to 6 months, turn around their symptoms of depression, whereas person A if there's no treatment, they haven't reached out and they continue to engage in those same behaviors, may experience those symptoms for more than a year, and it turns into a big cycle and maybe turn into major depressive disorder or even more severe in nature. Okay. So it really depends on the person, their readiness to engage in treatment, their experiences of depression. Some people may experience depression in waves, where some people, they experience it in a chronic or more chronic nature. Okay, so it just really depends on the person as it relates to healing from depression. So.
Okay, great. What are panic attacks? And does that mean that I am depressed?
Okay. So I love using my visual here. Yeah, you see my visual? Yeah, this is my visual. Okay. So I use this right here to kind of talk about panic attacks in the body. Okay. So here's my skeleton. We feel anxiety, okay, all through our bones, our bodies, right? Whereas when we think about panic, right, that's just a fight or flight response, right? I'm panicking because of something, okay? So our brain, if we think about our brain, we're just pretty much in fight or flight mode, okay? Now, when we think about panic attacks, most people think they're having a heart attack. They say, Dr. Cersei, I feel like my chest is sunk in. I can't breathe, right? My body is just shivering. Sometimes I feel things on my head. I just don't know, like I'm about to black out, right? It's not a form of depression. It's more of a form of anxiety, or when we think about anxiety disorders. However, someone who experiences depression or sadness or the symptoms of depression can also have anxiety and can experience panic attacks, right? So they can what I want to say is they can simultaneously occur together, right? But panic attacks is definitely more related to anxiety. Okay. So, and I wanted to add that. Yeah.
And can children have panic attacks?
Absolutely. But they can have, I call them panic-like symptoms, right? So I often ask children, draw it out for Dr. Cersei. Where on your body? They point to everything, right? And some kids, they actually describe panic-like symptoms to me. I don't really label it as a panic attack, but more like panic-like symptoms, because I don't want to label it unless they've really gone to the ER, they've had medical workups and it's nothing. But most times I see kids and they'll say, I had a panic attack. And I'll say, well, where did you learn about a panic attack? What is that? And they'll tell me what it is. And sometimes it's more related to having, just the heart palpitations, right? Sweating under their arms. And oftentimes they're hearing mommy or daddy talk about it, right? So they're hearing and looking in the environment for information versus experiencing it for themselves. So, yeah.
Okay, so our next question says, was somebody saying something? All right, our next question says, at one point, I was prescribed a medication called Buspar. Did I pronounce that properly? Buspar? For my depression issues. My hair thinned out, my skin dried out, my mouth stayed dry all the time. After some time, the prescription was changed to something called Wellbutrin. Okay, I guess I'm getting it right. Nobody's correcting me.
Right.
I'm okay.
Right.
Same thing happened. After some time again, the medication was changed to Prozac. Mouth is no longer dry. Skin is better, but not normal. And I have no hair anywhere at all. And no growth. I would like to ask the doctors, is there anything I can do? For a woman, I think she means to have no hair on her head is depressing, as well as no one takes me serious over it. Can someone give me some suggestions?
Yeah, I can say just full disclosure, I'm not a psychiatrist. I'm an internal medicine physician, but I can tell you that in every situation, in disorders that range from diabetes to renal artery stenosis to depression or anxiety, we're always challenged with balancing how well a medication works versus what side effects it's going to bring. And to the extent that we can treat you with a reasonable assumption, because we don't know for sure, it's an art. People say medicine is an art. So we think that this medication might help you feel better. Well, with that will come a certain risk for side effects. And every individual's tolerance for that side effect is different. And every medication approach affects every individual patient differently. So, to no fault to the person that gave you the medication, they don't know that until they give you the medication. Now, that being said, I think once you realize there's a side effect that's present that you personally say, I can't deal with this, whatever it is. It makes me dizzy. It makes me fall asleep too much. My hair is falling out. That's your rate limiting factor. That's your factor that says, I can't deal with this. Somebody else might be in a situation where their depression or anxiety is so bad, they're like, I'll take this relative to what I was dealing with before. So my point to you is just that if there's a side effect that's affecting you, first of all, if it's like,
I think Pete froze a little bit.
Yeah, and I was gonna.
Oh, there you go.
Okay, yeah, you're back.
Yeah. So if there's a life-threatening side effect, stop the medication and call your doctor. And just try to ask the physician to send you to a specialist that can help and has more experience with those kind of disorders so that you can minimize the amount of side effects that you have.
Absolutely.
I just want to add real quick, and I'd be remiss if I didn't, because I saw so many people, particularly men, that were having side effects of erectile dysfunction from many of the medications that they were taking, and then get sent somewhere to be treated for depression when that wasn't really the real issue. So could you, either of you, respond to that?
Okay. Well, I guess he was thinking of the internal medicine providers.
Yeah, I mean, the internal medicine providers often, whether it's high blood pressure or medication they're taking for something else, but oftentimes men may not say that they're having this particular issue, and that's what they're really depressed about. And so it goes untreated because they don't get asked.
Yeah, many of the patients I see are having a lot of issues with the side effects of medicine, particularly blood pressure medicine. And it's a tough situation because you're trying to buy time. And what I tell people is that if you're willing to sacrifice a little today to have more tomorrow, you're going to probably find yourself in a much, much better place. Most of the men, I tell men that your belly fat is, it's going to store estrogen in all of that fat. And that's why men have breasts, because of the estrogen. So if we can get rid of that belly, we'll probably have growth in other areas, not trying to be funny. So, and I'll be honest, if you want to motivate a man, you start telling him things he can do to be better down there. He'll respond to that. The irony of this conversation for me is that there's a condition called telogen effluvium, which is when you have hair loss after stressful things. And ironically, when you go on, whether you're doing a keto diet or you're doing a vegan diet like my colleague here, if you lose a lot of weight, your body thinks it's a stressor. And when you lose, so you actually can have hair loss from weight loss, which is interesting. It always, don't look funny like that, Nikki. But it always recovers. In fact, you get your good hair and when it grows back. But it's the stress that does it. It's not the diet. Yeah, I'm sorry, I didn't tell you about that.
Yeah.
But
go ahead. Yeah, and I was gonna say that I know there are side effects to medications. Oftentimes before we get to medications, and I'm meeting with patients, whether it's for anxiety or depression they're considering, I do talk about how the mind and body are connected. So again, I think Dr. Hampton, you just said it, if we're stressed or going through other things, right? Again, mind and body are connected. That could attribute to hair thinning, hair falling out. If we're wearing too tight hair supplements, or, ladies, we love the wigs, we love sew-ins, braids, and it's causing too much stress, that can also result in hair loss. But I also tell women and young men before we're taking medications to keep a log or journal for me in our sessions each week on side effects, changes, even hair loss, anything that they've noticed. So, just thinking about our viewers out there, if you're considering taking medications in the near future or switching your medications, something to kind of do is kind of keep a mental log or write it out of any side effects or what you notice as far as your appearance before starting medications. So,
I just want to support what Dr. Pete said about seeing another specialist, because the hair is considered an organ of the skin. This is something that some dermatologists specialize in. And this may be something we got two things going on at once. You may think it's a side effect, but by this length of time and to lose hair everywhere, I think that seeing a dermatologist makes a lot of sense. Because if there's a second process that you can identify, you might be able to treat that and fix that.
Yeah.
My expected side effects are most of the time you stop the drug, the body recovers. In this particular case, when things are going on and on and on, and more things are being lost, I like the idea of seeing a specialist. So thank you, Dr. Pete.
Yeah. Or just somebody like Dr. Nicole, who has, like, I have training in obesity medicine, so maybe you should see me. Dr. Nicole has additional training, as you know. So what you want to do is find somebody who has spent more time. Like, I can't compete with Dr. Jasmine when it comes to behavioral health. So why not spend some time with a Dr. Jasmine or a Dr. Nicole, and then you add value, and because it's going to impact it's not just impacting you. If you're depressed, the entire house has to deal with that. And so now you have the entire family tiptoeing around you, not knowing what to say, and it's just a disaster. So it's important that we address these, because now you may not have to be in a dysfunctional relationship because you took the time to get an expert to chime in.
Yeah, but I think it's important to note that so many of our families look for you as healthcare providers to provide that counsel. They just don't have the wherewithal, the knowledge, or the experience. So I think it's important for us to know that this level of debate and conversation is important for us as healthcare providers to provide the guidance for them.
Yeah, and I think the beauty of this conversation is the importance between behavioral health and medical, and combining those services together, and being able to go to one place such as the FQHCs, PCC, Mile Square, where it is all combined. There's the communication between the providers, and so integration, I think, is really important.
Yeah,
absolutely.
Yeah, I think that's something that we also stress at Near North too. And so when I see patients from a primary care side, I can do a quick handoff to Jasmine, and we can do a quick, debriefing about what I think is going on, and then she'll come back and talk to me. That's really important, and to have us in the same building to communicate with the patient, because many times patients may not, depending on the community, feel comfortable seeing behavioral health just because culturally they may not have been used to or have the comfort level of to say, hey, I'm seeing a psychologist or a counselor. And so sometimes it's better if we can do that soft handoff, and they know that, look, we're taking care of you as a team. There's not going to be anything going on that you won't be well aware of, and we'll both communicate about whatever's going on with you.
Absolutely. Yeah, absolutely. Yep. That makes a big difference. Yeah. So.
Awesome. So our next question says, what is and why does postpartum depression present itself in people who have never been depressed? And can it be prevented in a second pregnancy?
Yeah, that is a really good question. So if you think about it, in the postpartum period, you have quite a bit of change in your hormones, right? Also, you're not getting very much sleep, and you just underwent this incredibly stressful event on your body. Put in all of the factors like stress with breastfeeding or family support, or if you have other children you're caring for, that can be very challenging. And also, it's hard not to feel alone, right? It takes a little bit of time for mom and baby to bond sometimes. So all of those can make you feel this sort of down feeling. And then you have to separate out what is postpartum blues versus postpartum depression versus postpartum psychosis. And all of those are really important. And so we screen for that at follow-up appointments with mom and baby, as well as the postnatal visits too, because it can really impact how the family does, how mom recovers, how the baby does. And so it's really important to address and treat and sort of see where you are at. Many of them are natural to have. It's just important to get treatment for it and ask for help. It can happen to anyone, and it can happen with any pregnancy. Of course, if you have a history of depression, you have a higher risk, but just because you've never had depression doesn't mean that you're not at risk for it. So it's always something that we screen for, that we look to support our moms and families, because it is common and it's something that we really need to talk about, and women shouldn't sort of suffer in silence, because again, it can really impact their health and their children's health.
Absolutely.
So what are the signs, Dr. G? What's the signs? What should people look for?
That's a great question. So some of the signs are some of the similar signs we have with depression. So not feeling like eating, not feeling really down and sad, and not bonding as well. So those are some of the sort of symptoms. And then, of course, if it sort of persists and it's really severe, where you don't want to get out of bed, there's a whole sort of criteria and questionnaire that we ask specifically for moms in that period to screen for it. And then, of course, the psychosis, and this can, again, happen to anyone. If you think about it, if you have a very colicky baby and you're not sleeping at all and you've got no help, that also puts you at higher risk, right? Anyone who doesn't sleep multiple days in a row it has the potential. And that's when, you start having difficulty, thinking clearly, and, hallucinations, and it gets a little bit more complicated. But this is something that's really important for family and moms to recognize and ask for help.
So what role does nutrition play in any of this? Is there a role for nutrition in this category?
Yeah, I mean,
great question.
Absolutely.
Yeah, I mean, it's absolutely. I mean, just from me and Dr. Jasmine have talked about this. Even I think she mentioned it when we had a podcast together. Your gut makes most of the serotonin. So if you put garbage in your gut, then you're not going to produce. Serotonin is made for tryptophan, and so you can actually get it through tryptophan. But the bottom line is, you have to have a healthy gut. So if you eat inflammatory foods, it's going to cause a lot of inflammation. You're not going to create the hormones you need to be successful, these neurotransmitters, should I say. So yeah, it's a huge impact. And even just if you think about eating the wrong foods, you eat a slice of cake, your sugar goes up, then it crashes. Well, how are you going to feel when it goes down? You're not going to feel good. So if you eat a diet that is more level and it goes up, it doesn't go up too high, you do much better. So your diet could heal the whole list of things that it heals is incredible. And that's why our health systems need to partner with behavioral health. We need to partner with nutrition. We need to partner with all these different folk to help us guide patients towards a lifestyle that's going to keep them from being at risk. And in communities of color, as you already know, Mile Square, and I train where Bob is working with West Suburban Hospital. I had girls coming in at, I'm delivering babies for 12-year-olds, 13-year-olds, 14-year-olds. So imagine what their life is like having a baby at 12, and they're by themselves sometimes. It's literally, I remember a story of a kid who came in, she delivered a baby, and I said, well, where's the father of the baby? And I do not lie when she said it was past his curfew. I was like, you got to be kidding me. So when you hear stuff like that, and then you think about what kind of setting, and her mom was upset, so she didn't want to have anything to do with her. So now she has to, so it's a lot of factors, and we have to have a health system that can at least attempt to address some of these various factors. So hopefully with the new administration, we need to put more money at this stuff, and we need to get more people trained in these areas so we can help people. And that's why I really appreciate our guests tonight, because they really are leading the charge. I mean, they're working in communities that really need these resources. And this is the type of stuff that's going to make a difference. You just have to be patient and just do the best you can with the resources you have.
Absolutely. And I was going to add one more thing. Oftentimes, I do tell young women or women in general who've just had a baby, is that between, up until 4 weeks, and maybe Dr. Nicole, you can correct me, it's okay to experience that postpartum blues. But if it exceeds after the 4 weeks, that's when we're really getting into the depressive related symptoms of postpartum depression. So just something that's just like a little baseline or guideline. If women are out there, or viewers who've just had children, you're preparing for birth, just something to note. So
we have a ton of questions left. We have a ton of questions in the chat. So we are at our time. So want to just say thank you to Sharon Lester for all of her great comments she's been making, to Ms. Honey for saying hello. Henry McGee, I held your question till the end because on next Monday night, Dr. Terry Mason is going to do a whole segment about just what you are asking about. So, Henry McGee said, what causes your PSA to spike? So we're going to make that our very first question on next Monday. So Henry, I want to make sure that you are here and that you share, because we're going to talk about men's health on next Monday. So I'm not avoiding your question. I know it's here, but we just have something special dedicated directly to you and all the men in our lives, our brothers, uncles, cousins, dads, husbands. So here's the place to be on next Monday night. So many comments are here, even the comment that says, when is there going to be a part 2? So actually, it kind of is going to be a part last Monday of this month with the National Black Social Workers and the National Black Society of Psychiatry. We will be having a little bit more of this conversation. So you'll see a lot of your special guests that are here today with some additions to have some additional conversation to talk about COVID fatigue, and how important it is to get that vaccine. So just want to make sure, and I see everybody putting in the chat, part 2. Thank you guys so much. Doug, until our next Monday, we always ask that question. What do we want people to remember until next Monday? What's your until next Monday, Doug?
So I'm going to do some history. We know that I have a daughter who takes care of COVID patients 2 or 3 nights a week. On Friday, she got her second shot for the vaccination. About half a day later, she had muscle aches and joint pains for a while, low-grade fever, and then it went away. And then she went to interview for any job she could find that didn't involve taking care of COVID patients. This is very serious. This is very real. You want to get that vaccination.
All right, Dr. Terry Mason, our until next Monday. You're muted, Dr. Mason.
Congressman Davis, I just want to say very quickly, we want to say congratulations to Ms. Suzette McKinney, who now has been promoted to the head of the Life Sciences Division for a major company, Sterling Bay. And she's going to be leaving her post as the CEO for the medical district, for the head of the Illinois Medical District. She's a great, anytime we can cheer one of our own on, she's a great lady. And I think she'll do a phenomenal job here. And I look forward to our next week's topics.
All right.
All right, to Dr. Jasmine, our until next Monday.
Oh, until next Monday, I always say practice gratitude, patience, mindfulness, which is being present in the moment, right? Versus focused on the future or the past, especially if it gets us out of ourselves, our mind and bodies. Be more intentional each day and every day with every decision, from when you wake up to what you eat, to how you work out, to how you interact with others, and protect your peace. That's what I would leave everyone with. Yeah.
Wonderful. You know, I got to give this message to Dr. Terry Mason from Tamika Thomas. Hey, Uncle Terry. All right. Dr. Henry Taylor.
Yes,
You're
ma'am.
until next Monday. What would you tell the listening viewers, our viewers, what's until next Monday? What do you want to put on their mind? What are their thoughts?
Something very simple. Be kind to each other. That's it. Just that.
All right. Be kind to each other. Dr. Nicole, until next Monday.
Until next Monday, if you need help, reach out. There are multiple places that can support you. If you've lost someone that you loved from COVID and you need support, there are grief groups out there. So please reach out. You're not alone. Just because we have to socially distance doesn't mean that you have to suffer alone.
Bob, until
Yes.
next Monday.
We are here to help you. And I also want to say, Henry, you nailed it. Kindness to each other.
Dr. Pete, until next Monday.
Until next Monday, just remember that out of 30,000 plus patients that were in the trial for the vaccine, only 4 people got Bell's palsy. So let's stop using that as an excuse. And Bell's palsy is nothing but it's a paralyzed nerve in your face that goes away. So let's stop it and get the vaccine.
Yeah.
All right, Dr. Tony Hampton, until next Monday.
One of the advantages of what my brother, Dr. Pete, said is it's about continuous learning. And when it comes to this vaccine, you got to be careful what you believe. So what he just stated was an example. Now, I'll be honest, I'm going to say something dramatic. I don't care if a few people die from the vaccine. I'm not trying to be dramatic because it's a vaccine. And you're injecting something into a body. Now, let me tell you what I mean. Think about the millions of lives you're going to save. Every day when I go to my clinic, I report out 80 people dead, 100 people dead, 200 people dead in Illinois alone. So if we have a couple of people having a reaction to a vaccine in the world, who cares? We're going to save millions and millions of lives. So don't get caught up in that one story that you see on the news. Say, I told you so. That is not the answer. Every vaccine, flu, pneumonia, etc., every once in a while, somebody's going to react to it. But think about if you want to stop wearing a mask on your face and you want to give your family a chance, simply reconsider. Continue to continuously learn, whether it's through this forum or other reliable sources. And I guarantee you're going to find that over the course of time. I think in Advocate Aurora, we've vaccinated about 35,000 people with really nothing, no real incidents of anything. So, and we have people walking around our health system relieved. And some of them, again, cried when they got their vaccine. So I just encourage everybody to continue to learn and don't worry about Bell's palsy, which is, going to disappear in a few days when you could save your life. So a little dramatic, but I just got to get that off my heart.
All right. Okay. To our fearless leader, the one who truly teaches us that health is true wealth, one who paves the way and is a fighter for us in Congress and does not give up. That's the Congressman of the Illinois 7th Congressional District, our very own U.S. Representative Danny K. Davis.
Well, let me thank everybody for your engagement, your involvement, your participation. And since you're all physicians, what can I think of some good stuff? Well, we're going to be able to train 1,000 additional physicians because of the money that is appropriated for this year's budget activity. And so 1,000, based upon a bill that was chiefly sponsored by Representative Brad Snyder from the North Chicago, Waukegan area, that I was obviously pleased to be a co-sponsor of. That sounds like some pretty good stuff. But I'm going to go out on the limb. Dr. Pete talked about some of our needs. Tony Hampton talked about needs. And actually, I met with the mayor of Aurora this morning. Delightful gentleman. We're doing some work together on something. But I guarantee that we're going to get some more money for mental health. That we're going to actually get some more money. That we're going to get some more money for community health centers. As a matter of fact, we're going to not only get some more money, but we're going to pretty much guarantee their funding for 3 years, as opposed to them scraping every year and asking. So there are some good things on the horizon. We're going to have enough vaccine pretty soon for people who have not gotten theirs yet. I've had both. My first shot, nothing happened. My second shot, nothing happened. Matter of fact, my arm is not even sore. And I don't know that Henry Taylor and them can guarantee that when I just go over the
We guarantee it. That's the service we provide.
But nothing has happened other than good stuff. So until next Monday, I think Henry Taylor had it. Be kind. Because America is going through a phase and a stage right now, unlike anything that any of us have ever seen. We've read about it. We've heard about the Civil War. We heard about the Civil Discord. We heard about protesting who's going to be in office and who's not going to be in office. The period we're in right now is very reminiscent of the period during, before, and after slavery in this country. If you really want to get a recap, Dr. Jasmine can tell you what it's like being in South. Let me tell you, if you've never been there and you never lived there and you never experienced the differences, what you've seen on television does not quite paint the picture as vividly as it takes place. I grew up in rural Arkansas. And it wasn't quite like Mississippi or Georgia, Alabama, and Louisiana. So we've made a lot of advances. We got to keep them. And we got to keep letting people know that we will never, ever allow this country to go back. So forward, ever, backwards, never.
I agree with that, definitely.
All right.
Good night, and we'll see you next week. All
All
right.
right. So remember to wash your hands, social distance, and wear your face covering. More than anything, grab those face coverings and wear your face coverings. That's what's most important. Wash your hands, 20 seconds in the birthday song. Distance, stretch your arms out. If somebody's touching you or you're touching them, just ask them to move over just a little bit. We are at the edge. The vaccine is here. And make sure you wear your face coverings over your nose and mouth. Those droplets are what's dangerous. Remember, the life you save may be your own. Same bat time, same bat channel, right here next Monday night. Have a great evening.
Everybody. Peace. Be good.
All right.
Bye-bye now.